If a procedure is performed on a patient who refused consent, what can the phlebotomist be charged with? Battery. Which of the following procedures require informed consent? Invasive surgery. When a phlebotomy technician observes or suspects child abuse or neglect, which of the following should be the next step to take? Advise your supervisor privately. A patient needs to give a specimen from home. Which of the following should be performed first? Hand washing. Which of the following precautions require special handling and ventilation? Airborne. What item is donned first when wearing full PPE? Gown tied at neck and waist. What hospital department is responsible for sterile supplies? Central supply. What is the recommended disinfectant for blood and other bodily fluid contamination? Sodium hypochlorite. What technique uses heat, steam, and chemicals to prevent infectious disease? Sterilization. How should a phlebotomy technician dispose of a needle after drawing blood from a patient? Place the needle in a puncture-resistant container. What is the proper formula of compressions to breaths when performing CPR? 32. To avoid patient identification errors, what must a phlebotomy technician do to identify a patient prior to collecting a sample? Check armband for acceptable identifiers such as the patient's full name and DOB. What is the blood vessel that only carries blood away from the heart? Artery. A blood test that requires the use of multiple tubes was ordered for a patient. When should the tourniquet be released? Once the blood flow has been established in the first tube. What can happen if the tourniquet is left on too long before drawing blood? Hemoconcentration. A patient came to the clinic for a low-grade fever of 1 month duration. As part of laboratory workup, the physician ordered erythrocyte sedimentation. What color tube would be used for this test? Lavender top tube. Which of the following, according to the CLSI order of draw, would be filled last? Lavender top. According to OSHA requirements, what practice would help a phlebotomy technician prevent accidental needle sticks? Activate a safety device on the needle. Where should blood be drawn on a patient who has had a right side mastectomy and lymph node removal? The left antecubital fossa. Which of the following is not part of CBC? APTT. Which of the following is a normal result for a fasting glucose test? Under 100. What is involved in TB test administration? Injecting an antigen just under the skin. Which of the following must be done for a blood culture evaluation? Microorganism growth for septicemia. Use aseptic sterile techniques. Which of the following is a reason for a sample to be rejected by Q&S? Light blue with a 7:1 ratio. What is the procedure used to collect DNA from the cells on the inside of a person's cheek? Buccal swab. When drawing blood from a patient who uses blood thinners, what will be used after the draw is complete? Coband wrap. When performing a bleeding time test, what should the blood pressure cuff be inflated to? 40 mm Hg. What is the importance of the patient's ID number on the specimen tube labels? To avoid confusing specimens from patients with the same name. In hospital, the lab is backed up and one of the patient's specimen testing is delayed for more than 1 hour after collection. What should the phlebotomy technician do? Still send to the lab. Which department would perform a CBC? Hematology. A sample for fibrin degradation products testing would be sent to which of the following departments? Chemistry. For fasting glucose test, for how many hours at a minimum should a patient abstain from all food and liquids except water prior to testing? 8. Which of the following is the best site for a capillary puncture on an adult? Middle finger. What area should be used for a dermal puncture on an infant under 12 months of age? Heel. How many inches above a venipuncture site should a tourniquet be applied? 3 to 4. What color tube do most coagulation tests require a blood specimen to be collected in? Light blue top tube. Which test should be collected in a royal blue top tube? Aluminum. Which of the following gauge sizes would be appropriate to use when drawing a hand with a wind infusion? 23. What is an appropriate angle for a needle insertion when performing a venipuncture procedure? 15 to 30 degrees. After a venipuncture procedure, the patient begins to sweat, become pale, and is complaining of change in vision. What do these symptoms indicate? Vasovagal syncope. What does the term hematoma mean? Blood under the skin outside a blood vessel. Which of the following coagulation tests can be monitored on a patient using a POC instrument? PTT and INR. Which of the following tests should be protected from light? Vitamin B12. Which response from a patient would indicate that they have given implied consent to the blood draw? No, I don't want blood drawn. Where does a phlebotomy technician document poor techniques affecting quality sample? Quality improvement report. Which approach to infection control mandates that all blood and bodily fluids be treated as if they are infectious? Standard precautions. Which document in a medical office contains information on chemical products and relevant emergency and first aid procedures? SDS. A phlebotomy technician has received an order to draw blood on a patient. What should they do next? Collect the supplies. How can a phlebotomy technician ensure correct patient identification in a patient who has difficulty hearing? Point to the patient's name and date of birth, then wait for them to agree. For which of the following tests should the specimen be collected without a tourniquet? Lactic acid test. Which of the following additives is found in a yellow top tube? Sodium polymethyl sulfamate. What is the antiglycolytic agent in a gray top tube? Sodium fluoride. What additive is found in a dark green top tube? Sodium heparin. Which tube is used to check coagulation factors? Blue top. The gray top tube is usually drawn for which test? Glucose. Which of the following tests may require a special chain of custody from? Drug screen. What is the process called when separating the plasma or serum from a blood tube and placing it into a secondary container? Aliquoting. A plasma specimen has been aliquoted and delayed for testing. What is the maximum number of hours that the specimen can stay at the room temperature before being refrigerated? 8. Which of the following provides an example of professional appearance for a phlebotomy technician? Short and clean nails. A coworker asks a phlebotomy technician to cover for her as she returns from lunch late. What should the phlebotomy tech do? Tell the coworker that she will not be able to cover for her. What document states a patient's right to refuse a medical procedure and to be informed of all the consequences of doing so? Patient's Bill of Rights. According to the patient's Bill of Rights, which of the following represents the rights of a patient? To be treated confidentially, with access to their records limited to those involved. After having blood drawn, a patient says it hurts and the site starts to swell. What should a phlebotomy tech do? Apply pressure with gauze and re-examine the patient. What is the principal reason for requesting feedback when communicating with patients? To determine if they understood what is being said. During which phase of blood collection should a phlebotomy technician obtain consent from their patient? Pre-analytical. Which legislation establishes national standards? HIPAA. A phlebotomy tech mentioned to a coworker that the patient she had just drawn blood from has HIV. Which regulation has been violated? HIPAA. In accordance with the CLSI guidelines, how many unsuccessful venipuncture attempts can be done on a patient before calling another tech to assist? 2. What do OSHA standards require in order to prevent cross-contamination of microorganisms from one patient to another? Proper hand washing techniques. For an accidental needle stick, which of the following should be performed first? Wash the affected area with soap and water. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Which of the following is an antiseptic for hands? Antimicrobial soap. Which of the following is a blood-borne pathogen that can remain infectious on surfaces when not properly disinfected? Influenza. In order to prevent possible needle stick injuries, the sharps container should be changed when it is half full, 2/3. A patient fell while exiting the lab. What information would be included in the incident report? Date, time, and location of the fall. What is a government agency responsible for regulating safety and health of workers? OSHA. If the patient's specimen is lipemic, what does that usually indicate in regards to the patient? Not fasting. What body position for blood collection should be used for an outpatient who has previously fainted during a blood draw? Lying down in a reclining chair. A female patient has never had her blood drawn before. What should a phlebotomy tech allow her to do? Sit on a chair with arm support. When preparing for specimen collection by venipuncture, how should a patient be positioned? With the arm in a straight line from shoulder to wrist. After selecting a vein, what is the next step in preparing for phlebotomy? Wipe the area with an alcohol pad. What antiseptic agent is not appropriate for cleansing a collection site for a blood alcohol test? 70% isopropyl methanol. What is the maximum length of time that a tourniquet can stay on the arm before flow of blood is obtained? 1 minute. A patient presents to the outpatient lab for blood draw when the phlebotomy technician notices the patient's extremities are very cold to the touch. What technique may help the phlebotomy technician find a vein? Place a heating pad on the area to warm it. The doctor has ordered a fasting glucose level on an obese patient with inaccessible veins. Which collection equipment would be appropriate to use? Lancet. What may cause a false high potassium or false low calcium to be obtained? Inadequate centrifugation. The drive ordered a CBC comprehensive metabolic panel DT and a set of blood cultures. What is the order of draw? Blood culture light blue, SST lavender. Which of the following is true for the bevel of the needle? It should always be facing up when inserted into the skin. How should a winged infusion collection needle be held? By the needle wings. The phlebotomist must collect a preterm specimen from a patient with pores in both arms. Where is the best place to collect the specimen from? Below one of the IVs. Which test requires a whole blood specimen? CBC. How many tubes are drawn for a 3-hour glucose tolerance test? 4. What is included in electrode testing? Sodium and potassium. What is the recommended sample for urine pregnancy testing? First morning. When may a puncture site require additional pressure to stop bleeding? If the patient is on an aspirin regimen. Which of the following items are minimum requirements for specimen labeling? Patient's complete name, ID number, date, time of collection, and collector's initials. Which of the following specimens would be analyzed in the anatomical pathology area? Biopsy tissue. What is required for implied consent for a venipuncture on an adult patient? Patient extending an arm. During a venipuncture, a patient begins to complain of a sharp, painful sensation radiating down their arm. The phlebotomy tech suspects that a nerve has been hit. When should the incident be reported to the supervisor? Immediately. Which PPE should be worn when performing a venipuncture on a patient with HIV? Gloves. The current CDC guidelines for infections control is which of the following precautions? Standard. A phlebotomy tech slipped on a spill and fell in a patient's room. What agency would be involved in the investigation of this incident? OSHA. Venipuncture is usually performed in the antecubital area. Which vein is usually the best to draw from? Median cubital. What is the additive in a dark green top tube? Sodium heparin. What substance is in a serum separator tube? Fixotropic gel. A drive ordered a test to check for pregnancy. From which color tube top would a phlebotomy technician get a sample of blood? Red. What color top tube is used for thyroid panel test? Lavender. Which of the following tubes will yield a serum sample? Red top. A phlebotomy tech must collect a specimen on a 6-year-old child. The child is a little fearful. What should the phlebotomy tech do? Explain to the child in simple terms what will be done. A drive has ordered blood work that requires lavender, red, and gray tube tops. What is the correct order of draw? Red, lavender, and gray. During a venipuncture, when should a needle safety device be activated? After the needle is withdrawn from the vein. When are blood collection tubes labeled? After the specimen is collected. For how long should blood in a standard serum separator tube clot prior to centrifugation? 30 to 45 minutes. Which of the following specimens should be transported on ice? Bilirubin. Which of the following situations can result in legal action against a phlebotomy tech? Mislabeled specimen. Which area should be used to perform a multi-sample blood collection on a patient who had a left mastectomy? Right antecubital. What is a potential error in a prolonged tourniquet application? Erroneous results and potential nerve and tissue damage to the patient. What is the function of an antiglycolytic agent? Preserve glucose. If a laboratory test requires serum, which vacuum tube is a tube of choice? Red topped. What is an example of a QC measure in phlebotomy? Checking the expiration date of evacuated tubes. Which of the following will help ease a patient's anxiety during a venipuncture collection? Use a calm voice to explain the process from start to finish. In which of the following circumstances is it important to verify chain of custody? Legal samples. What is the first step that must be taken during a venipuncture when a patient has fainted before the blood collection is completed? Remove the tourniquet and needle. To ensure that the tests performed on a patient are accurate, what type of test must be completed in a physician's office laboratory? Control test. What is sputum defined as? Mucus from the lungs. Which BP is outside the normal range for a healthy adult? 136/94. When should the blood collection tubes be labeled? After the specimen has been collected from a patient. When collecting a blood specimen for an ammonia test, which of the following pre-analytical actions should be taken? Place the tube on ice immediately after collection.